Hello learners, I'm fine. Personally, I'm fine. How are you there? Are you also fine like me? Yes, I believe you're fine. You're ready to learn. You've been waiting for me to come back and teach you more about first aid. I know you can also be a good first aider there, and you have ever gotten an accident and somebody has ever given you help. That person who gave you help was called, you still remember? The person who helped you when you got an accident was a first aider. And you who got the accident, do you still remember that name? The name we give to a person who has got an accident is called a casualty. And what name do we give to that help the first aider was giving you? It is called first aid. The first help we give to a person who has got an accident. Right? Yeah. That day we also looked at things that we use to give first aid. The first aid kit. Those things we use to give first aid. And we also looked at that container, that tool, that box where we keep them. We said it's called a first aid box. And all those things we put in the first aid box are called a first aid kit. We mentioned some of them. You still remember them? Mention like 4. The simple ones, like plaster, that one is common, gloves, cotton wool, spirit, iodine, painkillers, and so many others. So today we have come to look at the uses of those things. Why do you need them? Why does a first aider need those things? We need them for a purpose. Those first aiders are not doctors, but they need to give first help before the person loses their life, right? Okay, let's go straight and look at the things we use to give first aid and their uses. Uses of items found in the first aid box. 1. These are all the things. I told you we are going to see them. There are very many. I have put like 14 here. Let's read them very fast. We have bandage. Bandage. Say bandage. Bandage. We have cotton wool. Cotton wool. Hope you're repeating after me. We have syringe. This syringe goes together with another one. They move together. They are always two, and I believe you have ever seen them. We have a syringe and a needle. Syringe and a needle. Then we have spirit. Spirit is in liquid form. They normally put it on wounds. You've ever seen spirit. We need gauze. Say gauze. Gauze. Then this is iodine. Iodine. Splits. Splits. Plaster. Plaster. Gloves. Gloves. Water. Water. Razor blade. Razor blade. Painkiller drugs. Painkiller drugs. A pair of scissors. Pair of scissors. Tweezers. Tweezers. Okay. This is the first aid kit. We have now removed them from the first aid box. Now we are going to see how are they used. How should you use them? In case you're the one giving first aid, what do you use and for what? And why do you use it? Okay, let's go and see. Bandage. See how bandage is being used? They are tying it around the arm. What do you think has happened to the arm? Even here. So bandage is used for tying the fractured part. Do you still remember what a fracture is? Remember we said a fracture is a broken bone. So when the bone is broken, they will use bandage to tie that part such that the bone doesn't shake to continue paining you. So bandage is used for tying the fractured part. As you can see in the picture, they have tied the arm here. Here they have tied the broken part. Let's go to another one. Cotton wool. See cotton wool? Somebody is using cotton wool there. And there is some blood around. There is some blood around. What do you think is using cotton wool for? Cotton wool is used for cleaning wounded parts. If you have a wound, don't get a piece of paper to clean the wound. It's better we use cotton wool, okay? And you can't use cotton wool alone. We are going to see what else we put on that cotton wool. Then we need a syringe and needle. But this one is not used by a first aider. This one is normally used in hospitals by the doctor because a first aider is not a doctor. But a syringe and needle are used for injecting the casualty. Injecting. Now this person who has gotten a fracture, you see, they are injecting him with painkillers and some medicine such that the wound heals. So we cannot put drugs into the body unless we have a syringe and needle, right? We need spirit. Spirit, you see that spirit? Even here spirit is there. This spirit is put on cotton wool, you see? Before cleaning the wound, they first put spirit on the cotton wool, then they clean the wounded part. And why do you think they put spirit? Spirit is put to keep germs away or to kill the germs which might be on the wound. So before they clean the wound, they have to put spirit on cotton wool. They remove all the germs which are on the wound before they dress it. Okay? That is spirit. Then we have gauze. You see the gauze? Gauze is here. Gauze is used to prevent germs from entering the wound. So before they dress it, before they dress the wound, they cover that wound with gauze. Here is gauze. We go to iodine. Iodine is normally found in a bottle. Though here that they have just shown us that they have put it on cotton wool, but it is always found in a bottle. Why do they put iodine? They put iodine to quicken the drying of the wound. If the wound is bleeding so much, they put iodine such that that wound dries and heals very fast. So iodine is very good. But when they put it on the wound, it's a little bit tough, very painful, but it quickens the healing of the wound. Okay? We have splints. The splints are here. Even that one is a splint. Even this one is a splint. You see? A splint helps the broken bone to stay in one position. So if the arm has broken, maybe from here, they will bring a splint, put it here such that it straightens the broken part, and they tie with a bandage to keep the broken part in position, in its position before healing. Then plaster. Hope everybody has ever seen this plaster. What do you think we need plaster for? Why do you think we need plaster for? For covering the cotton wool on the injured part. Sometimes this type of plaster has a material which acts like cotton wool inside. That's why they don't put cotton wool. But there is another plaster which they use in hospitals. It's commonly white or brown. It's like sellotape. That one is used when they are covering cotton wool. But this small plaster has a material which is like cotton wool inside, in the middle there, as you can see. So it is used to cover the injured part. Then we need gloves. You see how this person is bleeding? Is bleeding seriously. Maybe something has cut her on the hand, or is a child. So the first aider needed gloves such that he doesn't get infections from the wound. You know, this blood might have infections, and when you touch it without using gloves, you might get those infections. So these gloves help to prevent infections. As you can see, all the things which are in the first aid box. Okay, go to water. See water? Water helps to clean the wounded part of the casualty. Maybe you have stepped on a broken glass, it was dirty, it cut you, it was dirty. They first wash with water, then they put cotton wool, they put spirit to kill the germs, Then they use other materials like iodine, cotton wool, plasters to cover the wound. So we need water, a razor blade. See that razor blade? A razor blade is commonly used to cut. So it's used to cut gauze, or bandage as they are going to dress the wound. Painkillers, you see, somebody's feeling a lot of pain in the head. So you need some painkillers such that he or she reduces the pain. So painkillers are given to reduce pain. A pair of scissors is also used like a razor blade. It's used to cut the bandage or gauze when they are used to, or plaster when they are going to dress the wound. As you see, they are cutting gauze there. Then tweezers. Sometimes they are plastic, sometimes they are metallic. The tweezers help to pick cotton wool, to pick maybe stones from the wound or glasses from the wound. So we need tweezers such that you don't touch the wound directly. This one has just cleaned the wound. You see even blood is on the cotton wool. This one is going to use it to pick cotton wool or to remove broken glasses from the wound. But when we are giving, we have seen the few which we can put in the first aid box, but there are those ones which we can't put in the first aid box. They are very big. We cannot fold them. But we also need them when we are giving first aid. These are the ones we are going to look at. Other requirements needed in giving first aid. 1, a stretcher. A stretcher, we are going to look at how a stretcher looks like. A wheelchair, maybe the casualty cannot walk, so they put him or her in a wheelchair. And crutches. Let's see them. A stretcher. You see the stretcher? This one is a stretcher. That one is a stretcher. Cannot move. So they put you in the middle and they carry. You see that one? Have you ever seen it in hospital? Sometimes when they are playing football, you watch football, right? You see when they have knocked maybe a footballer, they run with a stretcher. They put the casualty on the stretcher and they move that person out of the playground, or they take him to the hospital. So this is what we call a stretcher. It's a simple bed for transporting patients or casualties. Then the wheelchair. Hope you've ever seen somebody moving in a wheelchair. It's a movable chair which helps to move those people who cannot walk. So they just put that person in a wheelchair, like that one is very happy even, like this one, and they move that person in a wheelchair. Then the crutches look like that. You've ever seen people using them? Maybe that person has a fracture, they give a clutch. This one is, you see this one? Sometimes they use that type. There are very many types. There are even those ones which are wooden. So they help a disabled person in moving, or a casualty in moving. Okay? Let's see. Why do we give first aid? What is the importance of giving first aid? Is it important to give first aid? Yes, it's very important. Why? It helps to save life. It helps to save life. In case somebody gets an accident and you don't help, he might lose the life. So it helps to save life. It also helps to stop bleeding or to control bleeding. Maybe a person is bleeding too much. So when you give first aid, you control the bleeding before that person loses all the blood. It reduces pain. When you give painkillers, when you clean the wounds and you help that person, it reduces the pain. Then it also promotes quick recovery. If you leave a wound without giving first aid, it might take long to heal. But when you give first aid, it quickens the recovery, or it promotes quick recovery, right? You see, somebody had drowned in water. The first aider came very fast to save their life. You see, he's saving somebody's life. This one was bleeding terribly. What do you think would happen if they did not give first aid? that person would have lost blood and would die. So it helps to control or to stop bleeding and to reduce pain. This man is in too much pain. You see the glass? The glasses are everywhere. They have entered the body. If they don't give first aid, might end up losing his life. So when they remove the glass, it will help to reduce the pain this man is going through. So we give first aid to reduce pain, then to promote quick recovery. If this person who was drowned was not given first aid, maybe would die very soon. But they are helping him to regain, to come back to normal. Then they take him to the hospital, and when they take him to the hospital, he will recover very fast. Okay? Thank you so much for listening. Hope you've learned the things we use to give first aid, and how we use them, and why we use them. Hope you're ready to give first aid to your friend, to mommy, to dad, to anybody at home whenever they get an accident. Okay? Thank you so much for listening. Have a lovely day.